Hello, everyone. Today's topic is the tibialis posterior. Location and function. Tibialis posterior is a muscle within the deep posterior compartment of the lower leg, situated between flexor digitorum longus and flexor hallucis longus. Tibialis posterior primarily functions as an ankle joint plantar flexor and inverter. It plays a key role in stabilizing the medial longitudinal arch of the foot. The tendon can be palpated both proximally and distally, immediately behind the medial malleolus, with the foot in plantar flexion, inversion, and the toes slightly extended. Muscle anatomy and fiber arrangement. The origin is the posterior surface of the upper interosseous membrane and the adjacent surfaces of the tibia and fibula. The interosseous membrane helps to divide the anterior compartment muscles from the posterior compartment muscles. The insertion of the tibialis posterior is the plantar aspect of the foot. So it inserts onto the bony inferior surfaces of the navicular bone, the cuneiform, and the cuboid bones, and bases of the second through fourth metatarsals. Although in some of the research I found, it said that it also inserts into the base of the fifth metatarsal. The muscle receives innervation from the tibial division of the sciatic nerve originating from the sacral plexus L5S1. This is a long and small muscle with a unipennate fiber arrangement, and this helps to produce the action of inversion and plantar flexion at the ankle joint during concentric contraction. And we'll talk about that role in daily usage during the gait cycle. So when contracted concentrically, tibialis posterior plantar flexes and inverts the foot. It plays the supportive role in elevating, tensing, and reinforcing the medial longitudinal arch, and it helps to distribute weight when the foot is planted on the ground. Most posterior compartment muscles, except for the popliteus muscles, are plantar flexors and are active during phases of gait. Different sources have different names for the phases of gait, but in our book, it references the lowering response as flat foot. So from the lowering response to the mid stance, the muscles of the posterior compartment are in eccentric contraction. And when the foot touches the ground from mid stance forward, it helps to stabilize and control the ankle joint in a closed chain dorsiflexion action. From terminal stance forward to the pre-swing to lift the foot off the ground, the plantar flexors fire concentrically to move the body forward. And then we'll see in this video here at the bottom, just basic movement of the ankle.
Next thing I'm going to talk to you guys about is inversion and eversion of the foot.
So you'll see the foot going inward, inversion, and then plantar flexion, downward, toes away the body. And then in this video, look at the ankle joint, initial contact. At the loading response at foot flat, this is where the actions create eccentric contraction in the posterior compartment. Mid stance to heel off, the posterior compartment fires concentrically. Plantar flexors are firing concentrically. Okay. Oops. All right, how to stretch tibialis posterior. Some basic stretching is the standing tib post stretch. You can use a chair You can use the chair or a wall if you stretch the muscle much in the same fashion as you would stretch the gastrocnemius. The affected leg is the back leg. You would lean into the flexion of the forward leg and then apply in a slight valgus inward movement of the knee. And this would start to create eversion at the ankle joint, and that will stretch the tibialis posterior. And progression, a sort of midway point, is the kneeling tibialis posterior stretch. So in this stretch, you'd come down to a half kneel position, bringing one foot out in front, keeping the heel planted, come into dorsiflexion, grip the ball of the foot, and then slightly rotate the foot outwardly in eversion, and then this would stretch the medial aspect of the lower leg near the malleolus. You should feel it slightly upward into the calf. An advanced stretch would be found in Janu Shirshasana C. This is a yoga posture. Translated to forehead to knee pose, third position. You can see this set up here in this top photograph. There's a lot going on, but focus on the ankle joint. You can see the toes are extended. There's a slight eversion to the foot. The ankle joint is dorsiflected. So following the description in the book, the talocrural joint is a dorsiflexion, eversion, and the metatarsal phalangeal joint is an extension. And this will stretch, actively stretch the tibialis posterior. How to strengthen the tibialis posterior? Starting with basic exercises using resistance bands. You can mount the resistance band around the base of an exam table or the base of a chair or a desk, looping the opposite end of the resistance band at the ball of the foot. In this video, the gentleman's going to show you what not to do first, is to let the movement come from the hip and make sure that the movement is coming from the knee joint below, primarily the ankle joint. So I think right here, he's showing you what not to do. The movement is coming from the patient's hip. So stabilize the hip, move from the knee down, curling inward against that resistance from the band. You can see on the picture below, the woman sitting on the exam table, the resistance band is mounted off to the right, and she's curling her foot inward, creating that inversion of the ankle joint and strengthening the posterior tibialis. A progression is moving towards standing heel raises, applies a little bit more force. Use the back of a chair, a high counter, a desk, a wall for support, lifting the heels off the ground up to the highest end or end range, working within full range, and then a slow descent back to the ground, working against the resistance from gravity. To progress this exercise, you would add resistance. You could use the load from a dumbbells or the load from a barbell across the shoulders, like a Smith machine. You would cantilever the foot off of a step-up exercise platform. And you would lift the heels up, balancing on the ball of the foot. This is the example of a second-class lever in the body. The axis of rotation at the ball of the foot, the resistance coming from the body, and then the fulcrum of the heel. Shin splints or a medial tibial stress syndrome is a common musculoskeletal sports injury that results from improper training technique, misfitting footwear, An increase in training frequency or intensity too soon or beyond your current capacity. Common among long distance runners, sprinters, dancers, and footballers, basically anyone who is in athletic. In layman's terms, this is a diagnosis for chronic inflammation affecting tibialis posterior, tibialis anterior, and extensor digitorum longus. This inflammation is usually a tendinitis of one or more of these structures caused by an accumulation of either stress fractures, periostitis, which is inflammation of the periosteum, which surrounds the bones of the lower leg or bones in the body, or it could be an advanced progression of a compartment syndrome. This was our discussion about tibialis posterior. My name is Marcelo. Thank you.